So somebody asked a great question on one of my recent posts. So what about immediate pressure headache during planks? So let's talk about this because I do think it's a really important thing to talk about, and it does come up with case or patients I've worked with. So when someone kind of develops head pressure or headache during an exercise or during a plank, there are a few possibilities that I kind of want to start to think about and what's going on when they're having these headaches. So the number one thing that comes to mind with those with migraine, aside from it just being a migraine trigger, is that maybe this person has primary exertional headache. This is a headache brought on directly by physical effort or strain, and it's typically a short-lasting headache. It can feel like pressure or throbbing, and it happens during or right after intense exercise. So these are generally benign, but they need to be differentiated from other headache causes in this case. Another thing I'm considering is intracranial pressure sensitivities. So sometimes people may have conditions where pressure inside the skull rises more easily, like in intracranial hypertension. Maybe they have impaired CFS flow or venous drainage. Another thing I'm considering, which is less dangerous than the others, is holding your breath or straining during this exercise, something called a Valsalva maneuver, that can also temporarily increase pressure in the head and cause these symptoms. And then the third thing I'm thinking of is technique or positioning. In this case, this is the most common thing I see. So when doing planks, people unknowingly hold their breath, they might be tensing or dropping their neck, and these subtle changes can increase the pressure in the head or the neck and bring on a headache. So here's just some of the questions I'd ask if this person was a client of mine and we're having a discussion. So does this pressure stop when you stop the exercise? Does this happen when you're in other similar positions, like lying down in your back or doing push-ups or in a hands and knees position? Are you holding your breath or bracing too hard during the plank? What is your neck position? Are you in neutral, a flex, or extended position? And does elevating it remove it or still bring it on? So after the questions, and those are just a few I'd ask, but if through my questioning there's no red flags, I'm not worried about any other conditions that need to be seen by a physician, we'll just start by adjusting the form and the breathing exercise. So we talked about keeping your head in a neutral position, maintaining a straight line from your ear to your shoulders. Then we work on breathing, making sure you're breathing in through your nose and out through your mouth. You're not holding that breath. And then we'll try modifying the angle. And then sometimes we just avoid the exercise for a while and then get back into it. What's really important here is identifying why you're having that symptom and what's happening, modifying and keeping the exercise safe. And if we don't think that exercise is safe anymore, we need to go back to the physician.